Thank you. I'm the late Joe Biden. I apologize. Usually when I'm late, I blame it on the president. But this time I blame it on a little crisis that's going on in Ukraine right now. I apologize. We couldn't lift off the ground because I had to continue a overseas call. And that's what made me late, and you're kind to wait for me. I really appreciate it. Joe and his family have become really close friends over the last several years, and my children and his children and my children much older. But first thing Joe said when he saw me, he asked about my son Bo, the Attorney General of Delaware, who went through a rough patch in terms of health, but he's doing fine, Joe. Thanks. It was a pretty Joe's life work, and probably a lot of you in here. There's a pretty profound thing about this country. Anything's possible. Anything's possible. You come here, Joe, you work hard, you have an idea, you start a business, you employ thousands of people. In the process, you save countless lives. That's what's great about Joe, but it's also what's great about all of you. This outfit here never stops. You never stop. That's the president calling. Would you please answer him and tell him I'm doing okay? All right? If you don't turn your phones off, the Secret Service is going to arrest you. All right? That's okay? Now you know why I get in trouble once in a while, right? You know what I decided a long time ago? I ain't changing my brand. I am not changing my brand. But look, that's what this summit is all about. When Joe told me about setting it up, before it was set up, I was truly excited about it, and I mean this sincerely. You're not just talking, you're walking the walk. And I don't want to get too personal, but unfortunately, my family has been a significant consumer of very serious health care. I lost a wife and daughter in an automobile accident. My two boys that survived were very, very, very badly injured. And wasn't sure they were going to make it. They're healthy, grown men now because of all of you. We had the finest health care in the world, the finest docs, the finest nurses. And by the way, for a guy who spent 59 days in ICU and 7 months in the hospital, you docs are important, but if there's any angels in heaven, they're all nurses. They're all nurses. So all kidding aside, I picked Joe's brains a lot about medical technology and the things that were changing because I saw a lot firsthand. I saw a lot over the last 30 years of the trauma and difficulty people go through. I fortunately, I didn't. I had great health care. And so when Joe told me he was setting this process up with some of you, I was excited. And I must admit, I invited myself a long time ago. But we couldn't, we couldn't quite work it out. But this is the third year here, and I want you to know I am truly honored to be in your company and truly honored to be invited. The first year, you all focused on priorities like preventing medication errors. That means, how to set up that automated infusion technology, because the guy who had it hooked up for 4 months, you wonder what the hell's going on in my arm there. Are they watching? But automatic infusion technologies and continuous patient monitoring. So patients receive the right dosages and right drug interactions. The second year, I'm told, you focused on life-saving initiatives like reducing infections acquired in hospitals and how safely to hand off a patient from one doc to another, from inpatient to outpatient, from outpatient to a primary care physician. And this year, you're back addressing very old challenges, such as early detection of sepsis, which is just a devastating condition, but often preventable, and also empowering patients and providers to speak up when there's something wrong, or at least when they think there might be something wrong. They may be wrong, but encourage them to speak up. And the results speak for themselves, what you've already done. Since the first summit, more than 500 of your hospitals, our hospitals, have saved over 6,200 lives by implementing your recommendations. And over the last, clap for yourself, you deserve it. And over the last 3 years, you've broken down silos between patients, providers, hospitals, medical technology companies, and government. By the way, that's what Barack and I are finding in terms of organizing government, not just in healthcare. It's breaking down the silos. The military is breaking down silos. We find that so much gets lost in the lack of communication. But that's what you're doing. And from my perspective, the most profound thing you've all done, I don't think you think of it in these terms, I may be wrong, is you've changed the vocabulary. You've changed the mindset and the way we talk about preventable death. As I said, my family and I have seen a lot of what it didn't go wrong, but what could possibly go wrong. We spent a lot of time in the hospital. I was at Reed for 6 months and ICU for 60 days and 2 craniotomies for aneurysms, et cetera. Really intense operations, but they were incredible. My neurosurgeon was one of those forward-looking guys. I mean, he's one of the best in the country, now retired. And the one who cooperated with him is still around, still head of the Department of Neurosurgery at the University of Virginia. A great guy. But they talked about, this is back 22 years ago, 1988, longer, 24, 25, 27 years ago now. And what they talked about then was, I remember we had these incredible residents. But I watched how they work, man. They work sometimes 24 hours in a row. It used to be viewed, I'm told, by my old doc that my old neurosurgeon was kind of a rite of passage, and he thought it was a ridiculous rite of passage. Ridiculous. But he was in a minority. He was in a minority back then. It was still sort of old school. And so what happened was they had ideas how to change the system, and a lot of you probably did. None of you are that old, I suspect, but a lot of you had ideas back then. But it wasn't sort of in vogue. It wasn't, how can I say it? It wasn't a major focus of the practice of medicine, including in medical schools, hospitals, insurance companies. The presumption was that something as devastating, for example, as sepsis, was just basically a cost of doing business. I don't mean that I don't think doctors back then and hospitals thought it was like, well, they were callous about it. But they had to focus on treatment, and it happens, and it happens. But things are changing because of you and Joe's leadership, all of you. We've gone from accepting the inevitable to showing what's absolutely within our wheelhouse to be able to change. And as you know, and as you've said, as you believe, there's no reason why we can't get to 0 preventable deaths by 2020. And there really isn't. I mean, it's not like we have to find a new cure for brain cancer. It's not like, which we're going to, by the way. It's not like we're going to have to find some fundamental breakthrough in the genome, which we will. This is within our wheelhouse. This is within our grasp. And I want you to know, the President and I are in the game with you. I really mean that. We, along with you and your leadership, we're trying to change the paradigm here. No longer will there be automatic payments, for example, to hospitals for Medicare and Medicaid when it bears no resemblance to success rates. High readmission rates, it's going to cost you. Now there's not just performance standards. It's not just we need performance standards. There must be demonstrable safety improvements in the areas that are within the wheelhouse of us being able to do. And I'm here to join the conversation you've been having for the last 3 years, to talk about how we in the administration look at this new paradigm and how we can help and invite, and I mean this sincerely, invite your constructive criticism of what we're doing or what we're not doing. And I want to start with some context here. My son-in-law, my daughter's husband, is a PhD neuroscientist and one of the leading surgeons in one of the leading teaching hospitals in the United States back east. And he, like you, the docs in here, is a consummate professional. But he has an expression. He often says, he calls me Pop. He said, Pop, the last place you want to spend unnecessary time is in a hospital. The last time you want to spend unnecessary time is in a hospital. Not because we don't have the best doctors in the world and the best nurses, the best healthcare professionals. We do. We absolutely do. Not because we don't have the best equipment and resources. We do. But up until now, our healthcare system, in my humble opinion, hasn't sufficiently linked quality, making good things happen, with safety of care. Not enough time has been focused on keeping bad things from happening that are able to be kept from happening. Now look, all of you have forgotten more about this subject than I've learned. But I have an overwhelmingly keen interest in it. And I've tried. But we want to do the things that are most helpful to provide for a reliable system to prevent bad things from happening. It gets down to systems in almost any gigantic endeavor. And healthcare is the biggest endeavor in America. The costliest, the biggest endeavor in America. You all know the statistics. 15 years ago, the Institute of Medicine estimated the number of preventable deaths in the United States hospitals was about 100,000. Today, a lot of you estimate it to be more than 200,000. Some say it's as high as 400,000. And that doesn't count the patients who've experienced medical errors but have survived. And some of you, I'm told are there advocacy groups for patients here today in this audience? Well, I don't have to tell you. Probably some of you, like me, unrelated to the reason you lost, have lost a child or lost a family member or lost someone. You know what it feels like to bring your child or your spouse or your sibling, your friend to the hospital, the care they need. They get the care, and then they die of preventable disease because of bed sore infections, or I could go on with all the things that occur. And nothing can fill that void in your heart. But intuitively, we all understand the incredible pressure that docs and nurses and hospitals have on them. And if you're a survivor of a medical error, you know the immense pain and struggle you go through to get your life back to what it used to be. And you find yourself asking, which you probably shouldn't, because I was taught never ask what if or why me. I once said after a difficult thing happened to me, first time I ever slipped, my dad was alive, and I said, why me? And he said, Joe, stop. And then he gave me a little cartoon, and it's on my desk. So this is 4 frames. And there used to be, I'm not a big funny paper guy, cartoon, but there used to be a cartoon, I don't know, a strip that may still be around, called Hagar. Hagar the Horrible. You know, the Norseman, you know? And there's a picture of Hagar in his Viking boat with his helmet hat and his horns in the hat, and the boat is in full sail, and he's standing under the prow. Next thing you know, there's a lightning bolt comes out of the sky, and you see the sail is charred, and his hat is burned, and the next frame you see, he looks up and he said, God, why me? In the next frame, a voice from heaven comes back and says, why not you? So it never pays to ask why me. But the truth of the matter is, it's different when loss occurs that people think are preventable, and loss occurs knowing that it was a real tough fight in the first place. I know, as I said, from long personal experience, that our doctors, our nurses, our healthcare providers work under enormous pressure. Enormous pressure. You all know yourselves when you've gone through something or a family member has gone through something that has been very, very difficult. All of a sudden you become an expert on it. So every time anybody has a problem, they call you. As if you, no, I'm serious, they call you. Who should I call? Who's the best doc? And being a United States Senator and then Vice President, I promise you, somewhere, my wife and I average it out, somewhere, if you average it out, 7 to 10 hours a week, we're on the phone talking to somebody, trying to direct them. Or my neurosurgeons still ask me to call people who are about to undergo serious, cranial aneurysms or other things. You all know the experience. And again, you know the difference between something that every patient knows this is a difficult one. My chances are less than even. And the one that goes in and my chances are 90%, I'm fine. And the worst happens. It just changes the psyche a lot. And I know the pressure is increasing on all of you. As medical professionals are faced with much more complicated circumstances, more complicated diseases. And I'm sure for some of you, there never seems to be enough time. I speak to a lot of nurses, national organizations. And the one thing I hear more from nurses in the last 20 years than I did the first 20 was not about pay, not about compensation, but about their fear that they have too many patients, too many rooms to handle. Not at all certain. They're afraid they're going to make a mistake or going to be an error. I don't have any doubt about the overwhelming dedication of the medical profession across the board. I know you've always had the best interests of patients in mind, always work with the self-awareness that one mistake can cost a life. And I know hospital administrators not only care about saving lives, but the incredible financial pressure under. They also have to be looking at the bottom line. They also know patient safety has a real impact on their bottom line. Medical errors committed in hospitals cost Americans $40 billion every year in healthcare costs, lost income and other expenses. Billions more are lost from errors in nursing homes, physician's office, other settings. So the challenge lies in the dedication of the profession. It lies in the complexity of the healthcare system. And it's complicated for everyone. It's complicated for everyone. You have surgery at a hospital where you're cared for by a dozen different people. You have 10, maybe 15 different machines measuring all different vital signs. And you have nurses that have to monitor them all the time. I remember lying in the ICU at Reed all the time. And, after a while, you get to read all this stuff. You watch them all. You're lying there 59 days, and you see the 8 machines up there. And you start wondering, what happens if that line changes? And sometimes you get so tired, it's not so much pain. You say, I'm just tired. I don't give a damn whether it changes. And you have nurses coming in and out, are incredible, worried that they're not alerted. My operation was over 22 years ago now. You've changed a lot of that, you tech guys and women. Then you're discharged and you go to the pharmacist, get your medication. You go to outpatient clinics for rehab with physical therapists. Or maybe you have to stay home and get home health care. When you go back to the primary care doctor who's practices across the town. On top of all that, most of the costs are paid by outside parties, whether it's Medicare, Medicaid, insurance companies, hospitals who bear a significant burden, who might resist investing in certain technologies if it affects their bottom line. The point of care exists across different places in different settings and requires a complicated teamwork, communication, and coordination. That's what you all are doing now. But here's the good news, which everyone in this room has figured out. You have solutions. And like other challenges we face, particularly in healthcare, the solutions aren't that many years away. Many of them are within our reach. There's no doubt about the moral imperative, and for some, a sworn oath to do no harm. But we also need a stronger economic incentive for hospitals and providers to improve patient safety. And we're getting there. We're now in the midst of a vast cultural shift in the way that we provide consumer health care. And we're finally starting to change the incentives so that quality, safety, and affordability are all in the same package. Now, here are three key ways the administration has focused its resources and investment to try to improve patient safety. And this is where I'd appreciate feedback after I leave, and I mean this sincerely. First, the President and I, the administration, are bringing our health IT infrastructure to the 21st century. When the President and I were sworn in 2009, we already lost 800,000 jobs that month, and 2 million more to go. We're in the most god-awful economic circumstance, short of a depression, America's ever hit in the Great Recession. And in the process, we felt we had to reestablish a lot of things, including the middle class place in the economy. So that's why we came up with a very controversial bill that now everybody thinks made sense, every economist, the so-called Recovery Act. It had almost $800 billion in it. It cut taxes for middle-class families. It kept teachers and law enforcement on the job in communities that were devastated. It put folks back to rebuilding our roads and our bridges and the largest public works investment project since Eisenhower's interstate highway system. By most objective measures, it was an absolute success, and it saved us from a depression. And I might add, I'm very proud, since I'm the guy that was in charge of it. Outside observers pointed out that less than 1.25% of it was waste, fraud, or abuse. There's never been a program that has been effectively administered without it. But here's the deal. And a critical piece was the effort to modernize our healthcare system. Remember the criticism we got, Joe, for putting $26 billion investment to get health IT off the ground? You did a lot more, but we put $26 billion in. It was intended to be the foundation on which change would begin to take place. And as a result, we've gone from doctors handwriting orders on patients' files to doctors typing them in electronically. This eliminates an awful lot of risk across the board. When the nurse walks in and grabs that clipboard at the bottom of my bed, you all know you doctors can't write. But all kidding aside, the likelihood of misreading orders to the hospital pharmacy was diminished significantly. In short, it enables hospitals to place automatic checks and ensure safety. But we got to get to the point where every doc, every medical institution talks to one another, that has a vehicle, an IT vehicle, so that I don't have to go to get my x-rays done at Papastravos in Delaware and then sent to my family doctor, Dr. Bourne, and I have to go get the slides, get the move, that automatically pops up. Things are changing. And mistakes are being eliminated. As you know, a lot of prescriptions get confused because they actually sound the same, look the same, but obviously have completely different purposes. And if the wrong one is prescribed, it can be deadly. It can cost a life. Automatic checks pop up on screens asking nurses or doctors whether that's what they intended the prescription to do. Warns them of potential lethal interactions with other drugs. That's what a lot of you tech guys have been able to do for us. You've also set up automatic trigger alarms when vital signs detect early signs of sepsis or respiratory failure. And I understand there's still a lot of work to do to ground this new culture. And it's easier for young docs and nurses than old docs. You know, but old dogs can learn new tricks. And by the way, I have a new definition of age. Any of you have birthdays? The last birthday I turned, I didn't want to acknowledge what it was. And then I remembered there was a great baseball player named Satchel Paige, who was one of I think probably the greatest pitcher in history had he been able to play in the majors instead of the Negro Leagues, the first 25 years of his career. So he goes up to the majors at age 45, and his 47th birthday, he wins a game in the majors. So the press goes into the locker room and says, "Satch, what's it feel like, man? 47, pitching in the bigs and winning." He said, "Boys, that's not how I look at it. The way I look at it is, how old would you be if you didn't know how old you are? I'm 42. But I'm deliberately trying to inject a little levity, but it is, you understand, it's hard, these transitions. People have been doing a certain way of practicing for 30, 40 years. The bottom line is more seasoned providers are basically learning a new language. And I know you're all working on this. And we need all of the tech companies to get in the game. All of you here are in, but there's a heck of a lot that aren't yet. A heck of a lot that aren't yet. So you got to reach out. We need your help. And here's the reality. You've already made a great deal of progress. 90% of our hospitals have adopted IT practices to better document, manage, exchange health information within and across all 50 states. The second thing we're trying to be helpful with, the administration, and I know it was initially controversial, but the Affordable Care Act is changing the incentive system for hospitals to provide more quality care, safety. With the Affordable Care Act, we finally enabled and ended a century-long debate about whether or not health care is a privilege or a right. It's a right. It's established in America. It's a right. That's the biggest thing about the health care bill. But it's also a right. It's also a right. It's only half the battle. It's also right for patients to be able to get the best possible care by focusing on areas that are preventable. You all know we're expanding by over 10 million people just last year, and hopefully similarly in this open period, which ends on the 15th of February. 10 million people gained health insurance last year through the Affordable Care Act or Medicaid expansion. Patients can keep their children on their health care plans, parents on their health care plans if they have health care till age 26, a gigantic change, easing a burden of providing peace of mind for parents. Because you all know anybody 26 to 35 thinks they're invincible anyway. Those of you who know people in that age category aren't getting insurance, tell them, do it for mom. Do it for mom. Insurance companies have to cover pre-existing conditions now. There can be no lifetime or annual caps. And it seems like everyone knows about that. But what they don't know about is how the Affordable Health Care Act is changing how health care is delivered and making it safer. By the way, this is the first time in 50 years that the rate of increase in the inflation in health care costs has been the lowest it's been in 50 years. Among many of the pilot programs the law supports, one is called Partnerships for Patients. It's almost a $500 million initiative to help more than 3,700 participating hospitals, treating 80% of the country's patients to reduce deadly medical errors. This is a true partnership. The federal government provided funding for hospital associations and nonprofits to create learning networks for other hospitals, other providers, patients, and patient advocate groups. Where one hospital figures out how to implement a simple checklist to reduce central line-related infections, it's able to also share it now more rapidly and quickly with other hospitals. Where one patient advocate group connects family members with hospital administrators, it inspires that hospital system to implement new protocols to reduce errors and save more lives. It is available. And now, for the first time in decades, we're seeing significant progress to reduce preventable hospital deaths and injuries. You know this better than I do, but from 2010 to 2013, it's estimated that 50,000 lives have been saved. More than 1.3 million fewer harms to patients from adverse events such as hospital-acquired infections, falls, bed sores, adverse drug events. More than 150,000 Medicare beneficiaries stayed home instead of getting readmitted to the hospital, an 8.7% drop. And in the process, the healthcare system was saved $12 billion. I'd like to mention the two most important numbers again. 50,000 lives saved, 1.3 million fewer harms to hospital patients. That's incredible progress you've generated. The third area where the President and I and the administration are working, as I've mentioned earlier, in the Health Care Act, is change the payment incentive system, tying quality and safety performance with payment. For example, if a hospital has a high rate of hospital-acquired infections or preventable readmissions, it'll have its Medicare, Medicaid payments reduced. And private insurers like United, Blue Cross Blue Shield, Anthem, others, are now following suit. Folks, that's a quick way to get the attention of CFOs in hospitals. They're not bad guys or bad women, but I promise you, it gets their attention. When there's a reduction of Medicare payments in a hospital tied to quality and safety that affects the bottom line, safety then becomes a priority. And they've got a lot on their plate. We're just getting started. This is time to double down on your commitment to patient safety, because we can reach the goal of 0 preventable deaths by 2020. I believe we can do that. We're not only willing to work with you, but we're willing to accept and seek your constructive criticism that I said earlier. How can we perform better? How can we manage this behemoth of healthcare we have, including the largest system, the veterans system? Ideas, we want them. We're open. There's no pride of authorship. But this will not get done without this partnership. The private sector, all of it, working together with the government. And that's why we've worked so closely with Joe and all of you on Joe's patient safety movement. The work I just talked about in Health IQ partnerships and payment incentives aligns with the themes of this year's summit. For example, sepsis strikes more than 1 million people in the United States. Between 28 and 50% of them die. More than the number of people who die from prostate cancer, breast cancer, and HIV/AIDS combined. Think of that. More people die from that than what everyone assumes to be the most deadly diseases out there. And many of these sepsis-related deaths are preventable. Not all, but many are. That's why in the learning networks I mentioned earlier, we're working with more than 1,000 hospitals to help them implement processes to identify sepsis earlier when it is treatable. And I'm also so glad that you're focused on patient and family engagement. I can tell you from personal experience how important it is to have an advocate in a hospital. It's important. And you all know, all you docs know, you can sit down with me and tell me that I have a 30% chance of living and the first aneurysm is bled and explain everything to me. And I may not hear it all. The patient doesn't hear it all. You make it very clear. But having an advocate sitting with you is important. You all know that better. That's why most of you invite and want folks in with the patient. Patients, families, orderly, nurses, all hospital personnel that I have encountered have to be encouraged and empowered to speak up if they see a potential risk or identify a way to improve the system without being seen as rocking the boat, without being seen as a troublemaker. This organization's done incredible work and made incredible progress. But I think we have as well. We know there's so much more to do. But we also know we have to do it together. Just think of the trajectory we were on. Decades ago, we didn't have hand sanitizers in public spaces. It wasn't until fairly recently, and my wife and I constantly are visiting our veterans hospitals all across the world, from Landstuhl to In my case, field hospitals over the years, my 20-some trips in Afghanistan and Iraq to read, and in every hospital we go to, there's a hand sanitizer outside. That didn't exist, I don't think, even 5 years ago. Just think that 20 years ago, central line infections were just the cost of doing business in the ICU, even if the cost was high mortality rates. Just think how we reduced the number of preventable hospital deaths, yet there's still 1 out of 10 patients at risk, and 1 is too many. If we're to achieve zero preventable deaths by 2020, we need more of you. We need more hospitals completely devoted to the game. We need more providers. We need more private employers. We need more private insurers. We need more consumer groups. We need more patients and families to get involved. Most of all, Joe, I think what we need your technology companies to share data so infusion pumps and anesthesia machines can talk to each other and warn the doc, warn the nurses of signs of trouble. They're not clairvoyant. But the opportunities, I think, as a lawyer and a vice president, which makes me totally unqualified to talk about any of what you're talking about. But all kidding aside, even from my perspective, a guy who studied this, the opportunities are immense. You are the most qualified, advanced, and capable healthcare providers in the entire world. That is a fact. And I believe, with your help, we can continue to transform the healthcare system. Like I said, it's no longer a debate about whether or not healthcare is a right. We should also end the debate whether or not quality care is a necessity. Thank you all for what you're doing. God bless you all, and may God protect our troops. Thank you for having me.